Great, thanks very much. And I'm very much an imposter here. I've never studied infectious disease in my life. So I'd like to make that very clear up front before we get into this. I have studied one of the most pernicious species on the planet, which is, of course, ourselves. And many people live in cities. And I've spent a large part of the last 17 years studying the interactions between people and nature in cities and trying to understand some of the dynamics of those interactions and mostly the beneficial consequences of interactions between people and nature. So it'll be interesting to see how some of that might intersect with the thinking that goes on here. I'm just going to throw out a few things that I've been studying, and then we'll see where it all lands in the mix of things that we talk about. That's not going.
To click the screen, yeah.
Get it into focus. Yeah, great.
Yep, there you go.
Okay, great. So back in the early days, parks in cities are deeply associated with infectious disease. It's kind of where they came from. It's one of the reasons why many cities were greened in much of the 19th century. Responses to infectious disease pandemics, particularly cholera. There was, of course, this idea that infectious diseases were spread by noxious air, that parks were somehow the kind of lungs of the city and would purify the air and thereby reduce infectious disease. So there's a kind of interesting, I think, historical connection between greening of cities and infectious disease. Of course, this lung metaphor is still widely used, but of course, now we realise it's a bit more nuanced than was previously thought. Interestingly, many of the people who were espousing this idea that green spaces are the lungs of the city were also talking about stress reduction as a beneficial consequence of some of this pioneering early urban greening. And of course, since then, there's been an explosion of interest in our urban environment, what that means for us as human beings, how our modern urban environments influence and impact the amount of interaction we have with nature and what the consequences of that might be very broadly across multiple aspects of human health and well-being. And of course, there's apocryphal statistics flying around, for example, that Australian children today spend less time outdoors than maximum security prisoners. And of course, these kinds of headline-grabbing ideas make us worry about the consequences of lack of interaction with nature, particularly in our cities. And with good reason. There's some really big epidemiological studies. This is a big one from the UK that studied 250,000 deaths across the UK and looked at green space around where those people live or lived, I suppose, and looked at mortality rates associated with that green space exposure. Overall, there was a reduction in mortality as the amount of green space around where the person lived increased. So this is a sort of spatial epidemiological study. Also, you can see there's an income differential within those green space exposure bands, and that differential was reduced. So in other words, green space exposure reduced overall mortality, but also reduced the inequity or the difference in mortality along the socioeconomic gradient. So big overall relationships between green space and mortality. And various lines of evidence, and I'm not going to go into it all, have shown that this is mostly driven through non-communicable disease, or at least it appears to be. That's where most of the research has been happening. Here's one example of a study here in Brisbane, led by Danielle Shanahan, looking at depression. And the chances of a person having depression reduced monotonically with the increase in their nature exposure. These kinds of studies, the evidence is difficult. There's all sorts of objections you could raise to a graph like this. But on average, it seems that depression cases could be reduced by 7% if individual urban dwellers spent at least half an hour visiting parks each week. So the majority of work has focused on non-communicable diseases so far in this kind of space. Who are these people that are visiting green spaces and doing more of that interaction with nature? Well, it's not the people that have more parks around them. So the graph on the left shows amount of park use relating to park cover, and there's no real difference in park cover in the 250 metres around a person's home in terms of how likely they are to be a heavy park user. This really flies in the face of what you might think. The variable that does clearly drive it is nature orientation. So nature-oriented people are spending time in nature regardless of the opportunity, if you like, the amount of nature around where they live. Lara Franco, a PhD student here a few years ago, took this a step further and delved into this nature connection. What is it about nature connection that is associated with the amount of time people are spending in nature? Actually, it's their level of experiential connection to nature. What does that mean? Well, they answer questions like, I enjoy being outside even when it's raining, I love getting my hands dirty, right? That kind of experiential connection with nature. These are people who are spending time in nature in our cities. There was no real effect of conservation perspective. So people who are visiting nature more are not necessarily more concerned about conservation or environmental sustainability issues, again, challenging quite a few stereotypes. Rachel O, just finishing up her PhD now, has done a comparative study of nature interactions between Brisbane and Singapore. And she's shown really two things of interest here. The first is that most of the interactions that we have with nature are indirect. Almost can't see any nature here at all. But out the window, looking out the window, indirect interactions with nature are most of what we get these days in our urban daily lives. Intentional, direct, real place-based interactions with nature tend to be rare, tend to be the exception, and tend to be a very particular type of person who's doing that a lot. Secondly, Rachel found some big differences between Brisbane and Singapore and in the sort of amount and types of nature interactions. Rachel also looked in Singapore, did a long-term study comparing nature interactions in 1996 with in the same suburb 22 years later. She found basically no difference. There was no big decline in the extent to which people were interacting with nature over that time. There's much talk about the extinction of experience of nature. Well, Rachel couldn't find any evidence for that here in Singapore when she looked closely at a longitudinal data set. Violetta, who's here in the room here, has been studying during her PhD some of the changes in urban green space use that's been happening here in Brisbane before and during the COVID-related lockdowns, and has published a paper very recently in People and Nature exploring these ideas. And the basis behind what Violetta is doing is thinking about nature, particularly urban nature, as a refuge in a time of stress, but also thinking about, the connection between urban green spaces and, of course, the pandemic that's raging around us right now. What do green spaces mean? Green spaces are some of the places you can still visit during a lockdown. Somehow we allow those nature experiences. It's a kind of safe place if appropriately managed. Violetta has shown dramatic fluxes. So what you're looking at here, and you don't need to get the detail, but it's the changes in the frequency of green space use before and during the COVID lockdown here in Brisbane. Violetta found that many people increased their green space use during those lockdown periods. Of course, our other options were reduced, but nature was very much a place where people could still go and increasingly went to. Yet some people reduced their green space use. There was an enormous amount of flux and change in how often people interacted with nature. Of the people that had reported they had never visited a public green space, 40% of those visited a green space for the first time during the COVID lockdown here in Brisbane, which is pretty dramatic if you think about what that means for the lives of those people. Older people tended to slightly reduce their green space use during the COVID lockdown period. And surprisingly, people with backyards were more likely to increase their green space use during the lockdown. So some really interesting dynamics that were coming out there. And of course, some of this relates to infectious disease management. Some of it may relate to infectious disease acquisition in urban environments. And really, ultimately, these kinds of analyses can help us think about the interaction and the connection between people and nature, what that means for human health and for urban biodiversity in particular. And I just want to draw attention, I think, to these sort of opposing ideas or the different ideas about what nature, the connections between nature and health. There can be a tendency to think about nature as a risk, nature as an exposure factor, nature as a danger for human health. But then there's tension there because there's all this research on the beneficial consequences of experiences of nature for people. And I think one of our big challenges as a group of researchers thinking about this is, how do we reconcile those two things, the risks and the dangers, and also the benefits of spending time in nature? And I think the urban environment really brings to the fore some of these very close connections that we have with nature that present some of these risks, but of course also many of these benefits to human health and well-being. So kids feeding the ducks in parks, wildlife rescue, another widely practiced activity that brings us into close contact with nature. So I'll finish there, and just to conclude, urban parks are really intimately bound up with infectious disease. It's one of the reasons we have major urban green space networks in the first place. But since then, there's been a big emphasis on non-communicable disease in the kind of urban people-nature studies. And one of the things we could do is try to change some of that narrative. Parks have really risen to the fore once again during the present pandemic. And I think there's this tension that we need to think about. Interactions in urban environments between people and nature can, of course, drive infectious disease risk, but can also give us refuge when infectious diseases are operating. So there's a few thoughts from someone who's not studied infectious disease before, and I'm really looking forward today to learning from the expertise of everyone in the room. Thank you.
Thank you.